Hi, everyone. I'd like to do a shout out to our sponsor, Baco Diagnostics. Early detection is the single most important factor in improving patient outcomes. The Baco Diagnostics team recognizes how impactful a podiatric physician can be and remains committed to supporting you in your role as the first line of defense in diagnosing conditions of the lower extremity. Thanks to the unwavering support of our clients, Baco Diagnostics has been able to give back to the podiatric community for 16 years by providing podiatric educational resources and advocating for the profession. Baco Diagnostics, helping podiatric physicians keep America on its feet. If you have not yet had the opportunity to utilize Baco Diagnostics services, get started today by sending an email to corporaterelations@bacodx.com. The first 50 podiatry offices who request a starter kit will receive a Dean's Chat mug. Hello, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and the host for the Dean's Chat podcast. Once again, I'm joined by my co-host, Dr. Joanna Ritchie. Hi, Joe.
Hey, Jeff. How you doing?
I'm doing fabulous. How was your weekend?
Weekend was good. We had some Girl Scout camping, chased some spiders out of a tent, and tried to be a grown-up about it.
How old is your daughter?
This was for my 8-year-old. So,
Your 8-year-old.
yeah, we had a lot of fun. Campfire songs and s'mores and how can you argue with that? Of course, I have to say, of all the weekends for it to be 32 degrees at night, maybe that wasn't the best. But they got to wake up to snow, which they all thought was pretty spectacular. So, and the cabins were heated, so I won't complain.
That sounds like a fabulous weekend. All righty. Well, we have a fabulous show for everybody today. As you all know, Dean's Chat is doing bonus episodes where we introduce students from each of the colleges of podiatric medicine to talk about their educational experience and really to highlight the different schools so that incoming students that are considering a career in podiatric medicine know what they're getting into. So I'd like to introduce our guest today from Western University College of Podiatric Medicine from the class of 2026. Welcome to Dean's Chat, Jessica Rangel.
Hi, thank you for having me.
Well, thank you for being with us. And also from the class of 2026, Jeremy Skelton. Welcome to Dean's Chat.
Hi, everyone. Glad to be here.
Thank you. And then from the class of 2027, I'd like to welcome Tony Cheeto. Tony, welcome to Dean's Chat.
Thank you so much. Appreciate it.
And I understand you go by Cheeto. That's your name.
Yes, sir.
Fantastic. All right. Well, let's get started. I'll turn it over to you, Joe.
Yeah, thanks so much, guys. We love having students on Dean's Chat. We love getting your perspectives and why you decided to come into podiatric medicine. But we do also like to have these episodes stand alone so that anybody that finds this particular episode will know what podiatry is. So, Jess, do you mind starting for us and go ahead and give us the definition of what is podiatric medicine?
Yeah, so podiatric medicine is a medical specialty that focuses on the care of patients that have any type of lower extremity pathology or disease. And that could be either surgically or clinically based, depending on the physician.
Thank you so much.
Thank you. And Jeremy, would you mind sharing with our audience the pathway to becoming a podiatrist?
Yeah, for sure. So it's similar to a lot of other medical specialties. Your undergrad can actually be in anything as long as you take some of the prerequisite courses that are required. Those are going to be like your sciences, like chemistry, biology, organic chemistry, things like that. And then after your undergraduate, you apply to podiatric medical school, which is 4 years. And then following medical school, you have a 3-year residency.
Excellent.
Very good. Thank you.
All right. So this is the really fun time. So what we're going to do is we're going to kind of go around the table. Cheeto, we'll start with you since we didn't get to hear from you yet. So if you can tell us a little bit about where you did your undergrad. We love to give undergrad shout outs and what your degree was in, because again, it doesn't have to be medicine or pre-med. And we find some very interesting undergraduate degrees. Then could you tell us a little bit about how you found podiatric medicine and if you got to shadow what that experience was like for you?
Yeah, so I went to undergrad at UC Irvine. I majored in cognitive psychology. I think going into undergrad, I knew I wanted to do healthcare, but I wasn't sure what I wanted to do specifically. So I was able to do a sports medicine internship there at UCI, and that exposed me to like a myriad of healthcare professions, including physical therapy, allopathic medicine, athletic training, and podiatry. So going into that, I basically was able to get my hands-on experience and try to see what I liked. And as I after I graduated, I took on more like jobs that included like being a medical assistant, doing clinical research, and eventually I came to the conclusion that I wanted to do something that was more hands-on and dealt with surgery. And since I was very sports focused and had a lot of foot injuries myself, I wanted to kind of change gears and look into podiatry. And that's how I found out more about it and just started my application from there.
Did you say you played sports?
Yeah, I did.
What was your sport?
I played basketball and volleyball.
And
Yeah.
volleyball. Awesome. Okay. Thank you so much. All right, Jeremy, let's we'll switch up to you and then we'll come back to Jess.
Yeah, for sure. So I went to Brigham Young University in Utah. I actually majored in business management. So I knew that I wanted to work in healthcare, but I was pretty confident that I wanted to work on the business side of healthcare. And so I majored in business management. I actually, after I graduated from BYU, I started working for a healthcare tech company, and I did my MBA with an emphasis in healthcare administration. And so I really enjoyed working. Like, there's a lot of things that I really enjoyed about it. But at the end of the day, I really found that I missed working hands-on with people. I got to spend every day in spreadsheets and trying to like analyze how we can, help more people or how we can make more money, I guess. And that was exciting to me. But at the end of the day, like, I really craved being able to interact one-on-one with patients. And so I decided to come back to school, and that's kind of how I landed here. Specifically podiatry, like a lot of other people, I had an injury and I had to go in and work with a podiatrist, and he kind of introduced me. I'm originally from Arizona, so he actually works in Arizona. So he introduced me to, the field and let me shadow him, and that's kind of when I fell in love with podiatry.
Outstanding. All right, we have to get the shout out. Who was it that you got to shadow in Arizona?
Yeah, his name's Dr. Mark Olson.
Oh yeah, awesome.
Yeah, he has a few different offices, like in Mesa, up in Arcadia, and then I think out in like Surprise or something like that.
Fantastic. Thank you so much. All right, Jess, bring us home. Tell us about your experience.
Yeah, so similarly, I went to undergrad at Marymount University, but that is actually located in Virginia. It's a sister school to Loyola, if you know about that from California. But yeah, I wanted to leave home and be on my own and see how that would go. And so I took a gamble and went across the to the other coast. And after that, I kind of had a couple of gap years. And mainly the first one was due to, I was like the part of the COVID graduating classes. So it was kind of like that moment of like, how do I apply to school and how do I get in? And when I first applied, I was mainly looking at MD and DO programs. And I had applied, but I kind of had a family emergency happen. My grandma had Parkinson's and she was kind of declining in her health. And so it was kind of me taking a break towards the end of my senior year of college. And luckily I was able to finish that just fine, but it was more of like, what do I do now with this going on? And all of us kind of gathered around trying to help care for her. And that kind of got in the way of my MCAT studying. And I still tried to take it. And I didn't get a bad score whatsoever, but it was just like, I could have done better maybe. And there was a lot of distraction going on. So it was figuring out, what do I do from here? And now I want to be in the healthcare field and I want to be a doctor of some sort. So I ended up trying to keep my brain sharp. I joined like my community college in Santa Ana and just started working and doing things there. And I kind of tried to do different avenues. I fell in love with speech language pathology and I was like, maybe I'll do that. And something was just calling me to be like, no, I think you want to be like a doctor in the healthcare field, a physician that's going to do hands-on work with patients. And luckily enough, I was trying to shadow doctors. And my mom's best friend is a office manager for a podiatrist. And she was like, you should definitely come. It's a great experience. And I got to do that. And I fell in love with it the first day I started. That doctor really took me under his wing and he was so knowledgeable, and just the relationship he had with his patients, I was just in awe of, and I was like, this is what I want to do. This is amazing. And I knew about podiatry, but for whatever reason, it never crossed my mind because he was my parents' doctor. So I knew him. I just never thought of it. And so it was like being in that space really like opened my eyes, and I was like, this is what I'm going to do. And yeah, here we are.
Excellent. Thank you so much.
Mm-hmm.
Those are great stories. Now, once you got into the Western University College of Podiatric Medicine, all three of you have had a tendency to take on leadership roles. And those leadership roles include involvement with the American Podiatric Medical Students Association, otherwise known as the APMSA. I was hoping that each of you could take a couple minutes and talk about how you got involved with APMSA and what your current roles and responsibilities are representing your student body at Western. Jeremy, do you mind starting for us?
Yeah, for sure. So, how I got involved in APMSA, I feel like I maybe sort of like I definitely like resisted the involvement at first, to be honest. I'm married, we have a daughter, and I just thought, no, I can't like take on any more stuff. But I ended up deciding, I'm going to go for it. I talked to a lot of people, and they had only like the best things to say about APMSA. But now that I actually have had a chance to be involved, like it's been such an incredible experience just to see how things like actually are working and how, change and progress is happening in our field in general. And for me, it's really empowering that like the students are getting to play a big role in that. I guess I had in my mind that it's just like a handful of doctors who are like a lot older who just make all these decisions. But at APMSA, we really do get a chance to like have our voices heard on the national scale. And then within APMSA, so I'm our 2026 rep for our class. So every class has a representative that goes to the House of Delegates. And then I've also had a chance to work on the board of trustees. And so just getting to interact even more with, these leaders of different organizations throughout podiatry has been just really impactful for me. So.
Well, thank you very much. Jessica, I was going to come back down to you because you're also in the class of 2026. How did you get involved with APMSA, and what are your current roles and responsibilities?
Yeah, so I have a funny way of how I became my role in APMSA, but I joined the SCPMSA club that we have at Western, which is Western's chapter of APMSA. And I was like, I don't want to be president. That's a lot of responsibility. I'll be treasurer. And unfortunately, our president had to step down from his position just because he had a lot going on with his own life. And it came to my plate and it was like, do you want to do it? And it was kind of like, no, I still don't want to do it. It seemed daunting from everything that everyone told me. And I was like, I'm good with numbers. But I actually got to meet with our past president, which was Brian Wong, who you got to have on the podcast. And him and our assistant dean were like, really like, I think you'd be the best fit for this and you should really go for it. And I was like, all right. So sign me up. And yeah, so I currently serve as the student body president for Western's chapter of APMSA. And mainly I just serve as kind of like an assistant to the other delegates at part of Western's board. And pretty much we just discuss things at APMSA, like Jeremy mentioned. We're a part of that national organization. But as a student body president, I also serve on the president's committee, where we talk about different things that might be going on with APMSA, especially the future Arizona conference that's coming up. And then we also help with selection of the student of the year, which we just did.
I bet
We are
that's
looking
fun.
forward to having all of you come to Arizona in March.
Yeah.
It'll be a great meeting. Well, thank you so much, Jessica.
Yeah,
so
thank you.
Cheeto, you're kind of the upstart on APMSA on this call, class of 2027. How'd you get involved and what are your current responsibilities?
Yeah, so the way I got involved and the way I found out about APMSA was during Welcome Week. I think Jeremy was actually the one to give a presentation on APMSA. I usually check out during like presentations, but he said somewhere along the lines of like 3 trips across the nation, and then I woke up. So so initially I didn't want to be involved in too many extracurricular activities, especially in medical school, just because I assumed that the workload and the responsibilities were going to be enough already. But Jeremy gave a good presentation and he's kind of sold me on that on the role of being APMSA delegate, and I didn't know what to expect before going to my first mid-winter conference meeting. But as soon as I got there, I saw how legitimate the program was. I saw how passionate a lot of these delegates were about the future of podiatry, and that ultimately got me more excited about the field and wanted to be more involved with the field. So since then, I've just been the 2027 delegate, and just my responsibility involved just finding out and updating my own student government and class about what's going on with APMSA, what to expect, and opportunities that may arise in the future. So that would be my job. Yeah.
Well, thank you. As Joe and I are always counseling students at the Arizona College, and we often tell them that the curriculum and the education is the cake, and extracurricular activities and research and things like that is the icing on the cake. So I think at this time, maybe we talk about the cake. Let's talk about the curriculum at Western. Joe.
Yeah, because it's always interesting to hear, and I love student perspective on like the why. Why did you get involved, and how did you get involved? Because your time is being pulled in so many different directions, and the curriculum is such a big part of that. And what we were really excited to do today is be able to help highlight all the wonderful things that the Western University College of Podiatric Medicine brings to the table. So, Cheeto, we'll start with you since you offered to do the first year class. If you can kind of talk a little bit about what courses could be expected for prospective students that are looking at Western as a potential home for their podiatric medical education, what those courses look like. If you can talk a little bit about if you're integrated with any other interdisciplinary courses in that year, and what those opportunities look like.
Yeah, so within the College of Podiatric Medicine at Western U, we are integrated within the DO program at Western U. So we are not only do we have our own podiatry curriculum, so we have a double curriculum. So we have the podiatry curriculum where we just learn about the lower extremities, pathologies, surgical interventions, all the clinical-based information regarding podiatry. Now, on a separate note, we have the DO curriculum where we're learning about the whole body system, like neuro, cardio, pulm, renal, MSK. And the unique thing about Western U is there's an emphasis on being a physician first, podiatrist second. And that can be good or bad depending on how you look at it. If you want to just be focused solely on podiatry, then that might not be the program that's for you. But I think that there's some benefits to being to go into Western U, just because your first responsibility as a provider is to know the overall body and the health of a patient first, and then how do you connect that with the lower extremity. So I think Western U does a really good job of integrating both, and I would say it's very challenging. If people are interested in being challenged, I think Western U can provide that, and I think they will prepare you for rotations, externships, and overall residency. So
and which courses are kind of grouped in that first year? You talked about some of the systems that you guys cover. Do they do certain courses in those systems, or how does that kind of look in that first year?
Yeah, so the first year, in the beginning, you will have a block that's called ISOM, and that's focused a lot more on the hard sciences like biochemistry, cellular bio, physio, and all that stuff. And then later on, you would enter into the next block, which would be about MSK, which is its muscles and bones. And then the next block would be, I believe it was, I want to say neural. So we'd learn kind of like the neural pathways of the brain. And in addition to all of those courses, you have the anatomy lab, which we had to kind of work with the cadavers, and each block is focused on certain systems. So then, if there's a block focused on cardio, then we would be focused on the heart in the cadaver lab. If the next block is focused on neuro, then we'd focus on the brain, right? So I thought that was a pretty cool course, just because I wasn't really expecting that into school. And, it was a shocker at first, but it really helped kind of reinforce the didactic learning that we had, with the hands-on portion of the cadaver lab. And yeah, so overall, that would be it would be the hard sciences, and then you move on to the next system, which is cardio, next system neuro, next system will be respiratory, and the next system will be renal and GI and so forth. Yeah.
Fantastic.
And then with regard to podiatry, is basically lower extremity anatomy, and then moving on to surgical interventions. No.
Like a first year surgery type course.
Yeah.
Okay. Fantastic. Thank you so much. All right. And then Jeremy, you had offered to do the second year for us. Can you talk a little bit about the which classes might still be integrated, or kind of what the second year looks like?
Yeah. So like Tony said, our curriculum is integrated with the DO program through our second year as well. Our school does the body system approach, like he was mentioning. And so we also do something called like a 2-path system, I guess, where you spend our first year learning about how all these body systems that Tony mentioned should be working, what happens in normal humans, what's going on at the physiological level. And then our second year is spent learning about what goes wrong and what do we do when they go wrong. And so we go back through all those same body systems that we studied in the first year, but this time we're talking about disease processes and treatment and things like that. And like I said, it's all still integrated with the DO program. And so, we're learning everything from the head to the toe. We also continue to do regular clinical skills like labs. And so every week, we're working with different professors who are coming in with, ultrasound equipment, and we're learning how to ultrasound, all different parts of the body, and learning how to do, lumbar punctures and all these different procedures that, medical professionals experience out in the workforce. We're doing, right alongside all of our DO colleagues. And then we also have clinical skills, kind of like examinations, where we go in with like paid actors who are pretending to be patients, and we get to actually practice, in a like safe, environment, how to actually be providers and how to actually counsel patients. And then we get feedback from them, on ways we can incorporate, different things to make the encounter, more humanistic, or help patients understand better what's going on, in their lives. So.
Excellent. Thank you so much. And Jess, if you can give us a little bit of an outline of what the third and the fourth year then look like.
Yeah, so third year, we get to now apply everything that you've learned first and second year. And that's when you get to now, after board studying, you kind of get straight thrown into working in the hospital. And as a third year, it's just mainly expected of you to kind of apply what you've learned and studied for on a daily basis. So you're rotating with different medical departments, whatever that might be for that person's track. And we have like 3 different ones. So you can either be in the Riverside area or LA, or have hybrid and do both. But you get to rotate at different hospitals, doing different, exploring different departments, and just applying your hands-on skills there. And it's almost like you're living the dream at that point. That's what it feels like for third year. But after that, we apply to externships, and that's where we get to basically kind of audition and put ourselves out there for residencies. And then after that, we will come back for a couple of core months of, again, reapplying those rotations here more locally for fourth year. And then you start applying for residency and interviews. And yeah, fourth year is pretty much kind of still doing the same thing. You're rotating at different hospitals and different departments, but you're just trying to hone in on your skills as a physician, future physician.
That's excellent. So when you said, how many externship opportunities do you guys get in that fourth year?
I believe it is 7.
Okay, excellent. And the core,
the months in my head.
the core is back in the LA area, or can they do
most
core
likely,
anywhere?
Yeah, most of our core takes place, back in California.
Okay, awesome. Thank you. One other clarifying point that I realize I've asked other schools, but not you. Because you have classes that are integrated with the DO program, what does that full class size look like? And then compared to like your podiatry, like small classes, just for some students really prefer more of a small kind of class size, and others prefer having a little bit of a hybrid, and others like really big class sizes. So what does that kind of look like at Western?
Yeah, so I mean, both Cheeto and Jeremy kind of touched on it, but basically we are alongside the DOs. I would say maybe 75% of the time. So it's about, the DO class alone is about 200 or so individuals. And usually our podiatry class is around average 30 to 50, depending on the year, depending on how many matriculate. And then what's nice is majority of the time, you're in that big classroom, like typical medical school size, like environment. And so it's a lot of different people, a lot of different personalities. And then what's nice though is that other 25% you're with your podiatry classmates, and that's such a small group of you, and you create your own environment, and it fosters a lot of like reliance on one another and kind of like a family and like friendly environment. So I think if you're looking for a big class or a small class, Western gives you the opportunity to kind of have both and enjoy both.
Excellent. Thank you so much.
Mm-hmm.
Jeremy, I had a follow-up question after the second year. How does Western handle boards preparation for part one?
Yeah, so we wrap up our second year of like in-class work around the end of April, I believe. And then we have all of May and June. I think this year boards were on like July 11th. So we have about like 2 months of dedicated board prep time. The first month in May was a lot of like on campus, like group work. And so they would bring in professors that we had had previously throughout the first 2 years to kind of do like refresher lectures for us, provide a lot of opportunities to go over things that maybe, you know, we want to review before boards. And then that month right before is pretty individual. You know, you can kind of take what you need and what areas you need to study and what you need to focus on and really, you know, hit those hard, yeah, and get ready for boards.
Fantastic. All right, one of our favorite parts of doing these discussions with the students from the various schools is we give you an opportunity to do professor shout outs. And Cheeto, I was thinking about starting with you. Any shout outs to professors that made a big difference in your educational career so far?
Yeah, I have a few. Shout out Dr. Wan. Dr. Wan is one of our professors at Western U. He pops in every now and then and teaches lectures, and he also gives a lot of life advice, and he kind of gives it to us straight. So, you know, there's no sugarcoating with that guy, but I respect it and I appreciate it a lot. Shout out to Dr. Momer. She's my research advisor right now. I do research under her, and she's also always giving advice, and she's super fun, and she takes away the pressure of med school a lot. Like we are constantly kind of bombarded with schoolwork, but when I work with Dr. Momer or talk with Dr. Momer, I always, you know, kind of see like the light at the end of the tunnel, right? She's always happy. She looks balanced, and she seems to enjoy her career. So that makes me feel very hopeful about my career in the future. And shout out to Dr. Sadra. She's in the Bay, but she's my actual faculty mentor, and she's always checking in on me and giving me advice about, you know, life and stuff too. So shout out to them. There's a few more, but I think off the top of my head, those are my shout outs for sure.
Thank you very much. Jessica, professor shout outs for you.
Yeah, Cheeto kind of took some of mine, but off the top of my head, Dr. Parks is one of our teachers, and we get to work with her also during our third year for rotations. And I just really love her style of teaching, and I think she just really makes your mind work. She'll like ask more prodding questions, and then what, and why is that? And I think I benefit from that the most because it's making me think back deep into the dark files that I've thrown away because time has passed, but bringing them forth and making me think like a physician should of like, why is that? But yeah, Dr. Wan especially, I want to shout out as well. He's just a really good mentor, and he does, like Tony said, give it to you straight. He's very almost like that tough love that you need for medical school sometimes, to just be like, hey, yeah, it's meant to be hard, but you can do it, and that's okay. And yeah, and Dr. Momer too, she's my advisor. So I go to her a lot, and I just always appreciate her advice. So yeah, thank you.
Thank you very much. Jeremy, professor shout outs at Western University College of Podiatric Medicine.
I honestly feel, yeah, you could probably pull out a list of all of them, and I feel like I could pick out something I'm grateful for each of them. All the ones that Cheeto and Jess highlighted, obviously have been huge influences for me too. I really appreciate that a lot of our professors do expect a lot of us. You know, like sometimes that can be uncomfortable if you don't, you know the answer right off the top of your head, but they have high expectations and they help us get there. Sorry, it's like a little loud. I thought I picked a really quiet corner, but it turns out it's like a happening place up here. So, one other person though is Dr. Augustus. He's actually one of our adjunct faculty. And we have a lot of adjunct faculty. And one thing I really like about working with them is they're also working out in the field of podiatry. They have private practices, they work in hospitals, and so they bring like a really unique perspective, that sometimes we might miss with some of our full-time faculty, where they can tell us like, hey, this is like how it works, and in like the quote, like real world, and I think that's really helpful. And they give good life advice, like Tony said, and they really do care not only about us succeeding here in medical school, but also succeeding like down the road too. So
very good, thank you. Professor shoutouts are our favorite. Also, we enjoy shouting out to our sponsor, Baco Diagnostics. We all know that early detection is the most important determination in improving patient outcomes. Baco Diagnostics remains committed to supporting you in your role as the first line of defense in diagnosing lower extremity pathologies. Baco Diagnostics, helping podiatric physicians keep America on its feet. Joe and I always love to give a shout out to Baco. I know they've been so good to all of the colleges with their educational foundation with scholarships, and then they come in and teach biopsy labs. So kudos to Baco. Joe, I'll turn it over to you.
All right. So we get to do a little bit of a transition to what was it about Western University that caught your attention, or why did you pick Western? For students out there that have already started interviewing, what were the things that really stood out to you? And let's start with Jess this time.
All right. No pressure. Yeah. So when I was applying, like I said, I had that kind of mentor of the doctor I was shadowing. And I remember asking him, I was like, if you could go, where would you go? And he was like, Western. He's like, if I was in your shoes and I was going to apply, Western would be my choice. And he's like, you're going to get that holistic experience of treating patients holistically, and you're treated like a physician, and you're going to learn how to do all the things that you want to as a doctor. And then the cherry on top is the podiatry. And I think that really spoke to me. And then when I got an interview with Western, funny enough, one of the student ambassadors there that was helping like answer a few of my questions was from my area. And he's from Anaheim, but I'm from Garden Grove, and there's cities right next to one another. And I was like, oh my gosh, like, what's it like? And he was like, it's great. And he's like, I do commute. And that was something that I wanted to do. And I was like, can you still commute and go to medical school with all the time you have to commit and all of the long drives and whatnot? I was like, yeah, you can. It's not even as scary as everyone makes it out to be. And I was like, okay, great. And I think hearing his perspective and just the other professors that I got to speak to during that interview, I just felt a sense of like comfort and support that I was looking for medical school. And knowing that I get to work alongside DOs and learning that holistic approach for medicine was really what I was looking for. So yeah, that's why I chose Western.
Excellent. Thank you. Jeremy, how about you?
Yeah, I feel like there's schools like all over the country that provide like top-notch education. One thing that really drew me to Western was that integrated approach, the chance that we get to learn like side by side. And like Tony mentioned, I think earlier, they want us to learn how to be doctors first, and then specialize like in the foot. And I just think that's like so important, because the patients we're treating, I mean, I think that the majority of patients that I saw today had diabetes, they had hypertension, they have these conditions that are whole body, but have a big impact on the foot and ankle. And so I really appreciate that about the Western curriculum. Also, from maybe like a shallower perspective, I grew up in Arizona, and like California weather, like you just can't like even compete with it. Like 75 and sunny most days, the beach down the road. Yeah, we really loved living here. So
You can actually open your windows at nighttime. I lived in California, in Northern and Southern California, so I'm right there with you. It's a beautiful state. Hard to argue with that.
Go on hikes in like July, like you just could never.
All right, Cheeto, how about you? What was the big draw?
For me, just basically echo what Jessica and Jeremy said. It was I like the fact that Western U incorporates the integrative curriculum, where we get to work with the whole body and we get to collaborate with not just DPMs, but future DOs as well. So it's always nice to kind of network with other students and kind of pick their brains as well. And I've heard through the grapevines that Western U was also very challenging. Myself, I prefer to be challenged every now and then. And I know medical school is already hard to begin with, but I always heard at UCI that Western U is super challenging, super difficult, and I just wanted to see where I stood with regards to that measuring stick, and I guess the other reason would be the proximity. So I live where Jess is from. I'm from Garden Grove as well. So uh, it's just nice to be able to go to medical school and then, spend hours and hours of studying. But, if you miss your family and friends, you can always go back to that, So there's always a semblance of home for me. So.
Yeah. And it's so fun to hear different perspectives because I think, Jeremy, to your point, there isn't a bad school out there. It's just really that feel of what was it that really drew you in? What was it that you liked about it? And to your point, Jess, you'll hear different things that you can connect with, like, I can see myself doing that. And those are the things that, again, that we appreciate you helping us highlight for the audience. So thank you. Back to you, Jeff.
Thanks, Joe. All right, I've got a two-part question for each of you. One, I'd like you to reminisce about something that your class enjoys doing together, perhaps after exams or after finals or something. And then secondly, what do you do to recharge your battery between exams to have a healthy lifestyle going forward? Jess, let's start with you.
Yeah, I feel like mine and Jeremy's class were just super close. I don't think there's ever a time where some of us aren't hanging out together or reaching out for help. And so when we're outside of the classroom, there's always a, hey, do you want to go grab dinner? Do you want to go grab lunch? Do you want to, I heard this place is good. Like, it's just always an opportunity to hang out together. And as a class, we try to do different events that even our school put on for us or that we do for ourselves. And we've had a few Halloween parties here and there. And we just try to hang out together because we're going to be each other's colleagues in the future. And we might as well build that relationship now. And it's just been great going on a third year now. So yeah, outside of that, when you have to recharge in between exams, I think I do best by going back to my roots. So I'm usually back home. I'm with my family and with my parents, my dogs, and my cat, and we're just all hanging out. I'll maybe see a few friends here and there, but it's mainly just going back home and relaxing and just taking a breath and yeah, just seeing what the next day is.
Sounds good. Thank you. Cheeto, what do you enjoy doing with your class and how do you recharge your battery between exams?
Yeah, so with my class, we're very close, just like the class of 2026. We oftentimes after an exam, we go out to go eat. We also have Halloween parties as well. Some of us have Disney passes. So the cool thing about you is we're only 45 minutes away from Disney. No, actually, no, like 30 minutes away from Disneyland. So you can always get a pass, and then you can always just book a day to go, and then all your classmates can all go together. And I think that's always fun, especially after an exam, kind of de-stress and forget about it. In addition, one of my classmates, Kyle, we always tend to go shopping after an exam. Good or whether we pass or don't do well, we just shop anyway. So I think that's always fun to do. Personally, what I do to de-stress, I have a husky at home, so I just spend time with my dog. And also on my free time, I like to do Muay Thai and Jiu-Jitsu. So that kind of just helps me de-stress and helps me be a little bit more present in my day-to-day, because if you're not present during Jiu-Jitsu or Muay Thai, you can get hurt. So you kind of forget about med school for like an hour and a half, like per day. So that's always nice,
Cheeto, I like that you referenced retail therapy for recovering between exams. That's a time-tested therapy, no doubt.
Treat yourself. For those of you that watch Parks and Rec.
Yeah.
There you go.
Treat yourself. You do good, treat yourself.
We love treat yourself in our house too. So I'm right there with you.
Exactly.
Jeremy, what do you enjoy doing with your class as an activity? And then how do you recharge your battery between exams?
For our class, I'm sure that they have other jobs that they do, but it feels like there's this entire department of staff that are in charge of planning parties and lunches and things. I feel like we're always having a lunch, or they're bringing snacks after exams, or they're planning some sort of get together. So that's been a fun way to connect. One thing that I have really grown to appreciate about our class, and maybe this a simple thing, but like even walking into like a lecture, I feel like I could sit down next to like anybody and like feel comfortable, you know, and I think that's just like a huge thing. Everyone's just kind and supportive. So personally, like I mentioned before, I do have like a family at home. I have a daughter and wife, so we do a lot of family stuff. We love going down to the beach, spending time outside. I got some advice at the very beginning of medical school from one of our faculty, like advisors. He told me to pick a day of the week, and like that's the day you like put studying down. And I know that that feels totally like unreasonable some weeks when you have like multiple exams. But I've really tried like to take that into my like, you know, life and how I like do things. And just like Tony and Jess both mentioned, like medical school is hard, but like finding a way to like ground yourself, you know, to reality and like focus on the things that are like truly important, whether, you know, that's family or friends or, you know, your physical, emotional, mental health, things like that. I think that's really important, you know, for students who are coming into medical school, for people who are already in, you know, podiatry school, just trying to find ways to ground yourself. And yeah.
Well said. You know, Joe, once again, I think our profession's in good hands with the likes of Jeremy and Cheeto and Jessica.
I agree. It's so exciting. I just have one follow-up question for you, Jeremy, because we do often have students that have families that they're bringing with them on this journey. On campus, you talked about there's a committee of people behind the scenes. Do they also have family events for students that have people with them? Or are they mostly focused for students?
Yeah, I think that for the majority of events, it's maybe like geared towards students, but I would never feel like uncomfortable like bringing, you know, like there's been a few times where we've had something where I've had to bring like my daughter, maybe my wife's at work, and everyone's just excited to see her, and you know, everyone's like very accommodating and like understanding. So yeah, and like the faculty checks in and you know asks questions, sends a text like, "Hey, how are things going?" Things like that. So you know, you're not just like a tuition payment. Like they really care about who you are and you succeeding in school and succeeding out of school. So
Fantastic. Thank you so much. I agree, Jeff. We've got some superstars in the rising here.
Absolutely. You know, one thing I wanted to mention, whoever does your social media at Western is a rock star. They do phenomenal work on whether it's LinkedIn or Instagram or Facebook or TikTok. Kudos to your social media people.
That's
Hazel.
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 Yeah, she does a great job.
It's a student.
Who is it?
No, she's one of our staff members. Name's
Okay.
Hazel. Her last name I will just butcher it, but her first name's Hazel, and but she just does an amazing job. She's always getting us in for a quick picture, and she's like, "We're gonna do this quick thing," and we're like, "Okay," and it always turns out great. So we appreciate her too.
Kudos to Hazel. That's fabulous. All right. Any last words, Joe?
No, I appreciate you guys so much taking the time to come chat with us and our audience, as I'm sure you all remember what it was like being a student, trying to make these choices and being able to hear stories and connect and have those relationships. Even though you may not know those people, it really matters. So we really appreciate your time.
Absolutely. Thank you. And to all of our listeners out there, whether you're listening on Apple Podcasts or Spotify, we appreciate a 5-star rating or maybe even make a couple of comments. And if you're watching on YouTube, by all means, become a subscriber. And until next week, everybody, cheers.
We're going to send you guys some mugs.
Absolutely.
So you can put whatever, it's kind of blurry. I'll put it right in front of my face. So you can get whatever beverage of choice you need while you study.
All right. Bye-bye, everybody.
Bye.
Thank you for having us.